Hey, today I just want to talk a little bit about my lack of treatment plan after mastectomy. I'm one of those unique women that does not have to take any medicines at all after having breast cancer, and there's a few reasons for that, and I just want to go over that today just to clear up any misconceptions. I feel like I'm getting a little bit of a following now, and I've dropped the hints lightly here and there that I don't take tamoxifen or any aromatase inhibitors. And I've talked a little bit about being open to doing so in the future, but the reality is I don't have to, and no doctor is asking me to. And I just want to explain a little bit more about why. Now, the truth is, if a doctor did ask me to take these drugs, I probably would hesitate, and I would have a really hard time doing it just because I know from, having lots of friends who have taken these drugs and my mom who's taken these drugs, and I know that they can make life really difficult. So quality of life tends to go down for a lot of people when you take any kind of endocrine therapy after breast cancer. And I feel extremely blessed and a little guilty that I'm one person that doesn't have to do so. There's a few factors that go into my decision and my doctor's decisions not to press for taking these drugs to just ensure, usually it's an insurance policy against recurrence for most of us when we do take them. For one thing, the main thing is that my type of cancer, lobular, it was only 2 millimeters in size when they found it, so that is remarkably small. It also tends to have a little bit less of a response to, especially tamoxifen, being that I have been premenopausal and still am premenopausal, although I have entered into the transition now. So in about a year, I will be postmenopausal and in menopause officially. I really wanted to resist the idea of taking any tamoxifen until I got through menopause naturally. I really wanted to experience menopause naturally. I feel strongly about that. I'm not exactly sure why. I feel very protective of my feminine rhythms, and I don't want to mistreat them or take them for granted or kind of discount them willy-nilly the way that a lot of medical professionals do, I believe. And so, yeah, that's just been kind of my personal conviction. Thankfully, like I said, I've seen many medical oncologists, and none of them have said you should be taking tamoxifen or you should be taking AIs. While I was given a grade 2, all lobular survivors are given grade 2 because the fact is, with the factors in place that make our grading system go as it goes, all ILC survivors are at a minimum a grade 2 because we lack the factor called E-cadherin that makes cancer cells stick to one another and make a lump. And so the grading system is really broken for us lobular survivors. It is totally 100% based on ductal and the grading system for ductal, which is a very different disease. So you might see that you're grade 2 on your paperwork and freak out because it's not grade 1, but the fact is if you have lobular, then you're not even given a chance to qualify for grade 1 because you're lacking that factor. The most experienced oncologist that I've talked to, the most savvy and research-driven person that I've talked to down at UCSF told me that we all respond differently to these drugs. Some people respond really, really well, and some people respond just horribly. And unfortunately, it doesn't correlate with the symptoms. No matter how well you respond to the drugs, the symptoms suck from almost everybody. So it isn't always worth it for all of us. And unfortunately, the technology that's been developed to test the effectiveness of the drugs on us hasn't been perfected yet. It's pretty close, I think, to being perfected. I'm not the one to talk to about that, but from what I can tell and what I've been reading, it is pretty close. And they do have a test that you can take after 5 years of treatment on aromatase inhibitors or tamoxifen to tell if they're working. And my guess is that you could take that test sooner, and probably in future years you'll be allowed to take that test sooner. It's called the Breast Cancer Index Test, and it is a pretty effective and trustworthy test. A lot of doctors trust it. So that's the good news. Before too long, we won't have to put ourselves through this hell of early or medically induced menopause if that drug doesn't work for us anyway, we'll be able to find out whether it's worth it to take those drugs. I'm really interested in tamoxifen and really interested in aromatase inhibitors, and I follow every article or podcast or blog post that I see from a medical professional or a surgeon or a researcher who's interested in these questions, because it does affect all of us so much in the breast cancer community, and hardly any of us get this permission to not take these drugs. And so I will be following them, and hopefully I'll be making more videos as I find out more. I'm going down to San Antonio this week for the San Antonio Breast Cancer Symposium, and there will definitely be some discussions about these drugs down there, no doubt. And I'm sure there will be more and more of these drugs coming out. It seems like aromatase inhibitors are kind of always fluctuating and on the move and being perfected. They have a much different mechanism than tamoxifen does. One really interesting thing that the doctor I saw at UCSF told me was that, in my mind, aromatase inhibitors are acting on the fat in your body, which obviously they are. That's their main mechanism. In my mind, I was thinking that aromatase inhibitors would be more effective the more obese or overweight you were. And as a thin person, I figured they probably wouldn't be necessary for me. But my doctor corrected me in that thinking and said that actually it's the opposite, that aromatase inhibitors will go after your cancer cells more readily when you have the less fat in your body. And it's more effective for thinner people, perhaps, than it is for obese or overweight people. So that was really interesting. Sometimes, the natural assumptions are not the truth. And so it's always good to ask those questions. And it's wonderful when you have a really well-informed oncologist and researcher that you can sit with and ask those questions. Really, my main goal in this video today was to mention that breast cancer index test, because it is so important. It can alleviate so many years of suffering if you are suffering with the side effects of these drugs. If you can find out early that you shouldn't need to take them anymore after the first 5 years, and maybe even your doctor could order them a year early, perhaps. As months and years go by, I'm hoping that these tests can be taken even earlier, because 5 years is way too long, in my opinion, to suffer with the side effects of zero estrogen in your body, which we're just not meant to live like that, especially when these drugs are not effective for many of us, maybe half of us that take them. So my hope is that we can get back to a place where we are letting ourselves produce a little bit of estrogen, and that estrogen can benefit us long term without hurting us. It's not black and white. The estrogen is not always the enemy, especially not our own natural endogenous estrogens, the ones that we create in our own body. It's tricky and very, very hotly debated, and I'm not the expert. Again, you have to talk to your doctor and get their advice, and if you've chosen a doctor that is not worthy of taking their advice, then you need to find a different doctor. But I recommend functional doctors. I feel like they're much, much more well-versed in the research, and also just going to experts. Like I was saying, the expert down at UCSF, Dr. Mukhtar, has been the person that I'm planning to go to if I ever have any questions about ILC in particular. She was the one that explained things to me the best out of everyone that I've talked to, and so that's who I'm relying on, and I encourage you to find someone like that too. And if you've been on tamoxifen or AIs for the last 5 years and you're ready to get off, be sure to look up that test called the Breast Cancer Index Test and ask your oncologist to run that test on you. In many cases, it may even be covered by insurance, especially here in the U.S. And that would be what I would be seeking myself if I was having to take these drugs. I would find a way to get that test as soon as I possibly could, even if I had to pay out of pocket for it. And so I want that for you as well. And so for those of you who've been asking me in the comments if I'm taking tamoxifen or if I'm taking any aromatase inhibitors, the answer is no, I'm not. And if I had an oncologist that asked me to do so in the future, I would do so after I enter menopause naturally. I would take aromatase inhibitors, even though I have a family history of bone weakness and osteoporosis. That definitely is not a good match for those. And my mom actually took tamoxifen in her 80s because of that issue, because her bones were not very dense. And so it would be costing me quite a lot to be taking those. And I won't take them for no reason at all, or even for the reason of improving my odds by 1% at this point. So that's where I'm at today. Definitely re-ask me that question in a couple of years. Maybe I will have changed my mind after I've gotten fully into menopause and let my body transition into that space. It will be much more of an option for me at that point, I think, than it would be today. That's all I have for today. Kind of a tricky subject. There are different elements in this discussion and this decision for every single one of us, depending on a lot of different factors, mostly the things coming out of our pathology report. And I will list below the specific tests that Dr. Mukhtar said influenced her decision about whether or not I should take these endocrine therapies like tamoxifen and AIs, and the reason that I'm not. Besides the fact that my piece of cancer was just a very, very tiny little lesion. So hopefully that satisfies those of you who are curious, and if not, then leave comments below and I will make clarifying videos in the future. And I'll be back to talk about my experience down in San Antonio next week, and I'll see you then. Bye-bye.